My name is Erin Williams, and the disorder I have chosen is bipolar disorder. Bipolar disorder is described as a manic depressive brain disorder which causes unusual shifts in mood, energy, activity levels, and the ability to carry out tasks. Bipolar disorder is categorized and described by having two main things that interact with each other. The first is mania. So mania can be described as abnormally elevated or expansive mood, extreme excitability, elevated sense of self-importance, and sudden shifts to extreme irritability, hostility, or even anger. This can be anywhere from a few hours to a few days to a few weeks, depending on how intense the disorder is. The other is depression, which is feelings of hopelessness or worthlessness, exhaustion, no interest in the people, activities, and things that once mattered most, and changes in appetite, sleep, and concentration. Bipolar disorder is a little bit different. Bipolar disorder depression is a little bit different than average depression because the exhaustion that's often related with it is often coming from the manic episode. It's like kind of like the aftermath. There are 3 defined types of bipolar disorder. The first is bipolar 1. This is the most extreme of the disorder. It is described as manic episodes which last 7 days or more, or if the manic symptoms are severe enough to require hospitalization. Also includes depressive episodes typically lasting about 2 weeks, or mixed episodes of mania and depression are also possible. The second, which is a little bit less severe, is bipolar 2. The symptoms include a pattern of hypomanic or depressive episodes, but none of the manic episodes are full-blown manic. They're all just hypomanic. So none of these would require hospitalization. Therefore, they're categorized as bipolar 2. And the third is cyclothymic disorder, which is defined by a number of hypomanic episodes and depressive symptoms for at least a span of 2 years, so kind of just off and on random spurts of manic episodes or depressive episodes, but these episodes do not meet the requirements for a full-on manic or depressive episode. They're kind of just lessened versions of each of these. There are also a bunch of different types of bipolar disorder. They're just not necessarily defined or named because there are so many different variations of this disorder in terms of the experiences with the mania and with the depression and how those correlate with one another. Bipolar disorder is typically thought of as like a rare disorder. You don't necessarily think that, oh, my next door neighbor has bipolar disorder, but it's actually pretty common. 2.6% of the U.S. population who are 18 or older has some type of bipolar disorder. So for treatment, there are 3 main classes of medication. These include mood stabilizers, antipsychotics, and antidepressants. But antidepressants are iffy because the safety and effectiveness are sometimes controversial. Sometimes they can either activate manic episodes or just make the depression even more problematic because it is a different type of depression associated with bipolar disorder than it is with just regular depression. And typically lithium, which is a mood stabilizer, is prescribed, which is mostly a treatment for mania and it also is typically combined with something to treat the depression. So typically if they tell you you've got bipolar disorder, they'll typically put you on lithium first just to see how that reacts because it's just a mood stabilizer and it probably won't affect you in such a crazy way that it would spark a manic episode or a depressive episode or anything crazy like that. It's just a nice ease into it. Typically, treatment as a whole entails a combination of at least one mood stabilizing drug and or a typical antipsychotic and psychotherapy. So not only are you taking lithium or depression medicine or antipsychotic, but you're also going to therapy and talking about things and making sure that everything's working out. Alright, so the parts of the brain which are involved. Scientists are actually still working to discover just how bipolar brains differ from neurotypical ones, because it's such a widespread disorder and there are so many differentiations between them. It's kind of hard to pinpoint exactly where in the brain these differences are occurring. However, some discoveries have been found. Loss or damage of cells in the hippocampus, which is a part of the brain associated with memory, can contribute to mood disorders. They've also found that imbalances in neurotransmitters, which are messengers in the brain, can be linked to bipolar disorder. If the mitochondria, or the inner energy centers of the human cells, don't function normally, it can also lead to discrepancies in energy and behaviors associated with psychiatric disorders. Also, researchers who have done an MRI scan on bipolar brains have noticed elevated signals in parts of the brain associated with voluntary movement. This suggests abnormal cellular function. So nothing set in stone has been found, but it's definitely a couple of advancements which might be able to push us in the right direction of figuring out just how this is caused and how it affects the brain differently than a neurotypical brain. There are also some environmental factors to consider. Just make sure. It's the end of the PowerPoint slides. But there are also some environmental factors that need to be considered, because these different situations can trigger symptoms. If someone is predisposed to the disorder, or they just suffer through a lot of trauma, if they have this predisposition, it'll trigger it and actually activate these symptoms. If the trigger did not exist, it might actually just be a dormant disorder waiting around for the day to be triggered, especially for people who may already be at a high genetic risk. So some examples of environmental factors which might trigger these episodes are extreme stress, physical or sexual abuse, substance abuse, death of a family member or loved one, physical illness, or ongoing concerns that affect your daily life, such as money or work problems. So typically these triggers would most likely occur in like a low socioeconomic type of environment. So extreme stress can happen anywhere. You could be in college working on a thesis, or you could be a pregnant mother of 2 already and struggling super financially. Physical or sexual abuse typically occurs when the person is younger, and that trauma will continue on to affect them for the rest of their lives, which will definitely trigger symptoms if one is predisposed to bipolar disorder. Substance abuse can be related to, like, if their parents were substance abusers, that'll definitely trigger it, because that'll also cause extreme stress and can also be a form of abuse on the children themselves. And typically those who have parents who do abuse either alcohol or drugs typically go into abuse them themselves, which can then trigger these symptoms of bipolar disorder. Death of a family member or loved one. So if someone was super close to, let's say they had like a girlfriend, or they were really close to their mom and they passed away, and it caused them extreme trauma and extreme stress, that could definitely be a trigger to trigger either a manic or depressive episode, or just make the disorder come out of its shell and really take it on full blast. Also, physical illness can trigger this, because a physical illness would definitely cause extreme stress, which again is a trigger. Physical illness can cause tons of different stresses, and could probably even lead to substance abuse. If you're hurting so much physically, you'd probably resort to either drugs or alcohol. And then just ongoing concerns that affect your daily life, such as money or work problems, which again would tie into stress. Stress is just a big trigger for this, and I'm sure many other disorders as well. So in review, bipolar disorder is actually pretty common. 2.6% of the US population who are older than 18 are affected by it. There are 3 different defined types. That's bipolar 1, bipolar 2, and cyclothymic disorder. And of course, like I said before, there are also numerous other ones. They just haven't been necessarily defined yet because of the ambiguities involved with that, and nothing's been set in stone. Typical treatments are mood stabilizer, antipsychotic, psychotherapy. And the parts of the brain that involved are the hippocampus, neurotransmitter, mitochondria, and abnormal cellular function. All right, thank you.